For daily Ask Reddit. r/ask Reddit. Doctors of Reddit, what's the biggest case of faking it you've ever seen? I once saw a patient who had been faking paralysis of the legs for years. Used a wheelchair, never walked, etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family/friends were just going along with it, not sure if it was really conversion disorder or if the patient had some secondary gain issue. That's so baffling. I'm a part-time wheelchair user and I don't know why anyone would choose to make the world more inaccessible to themselves. IKR, wheelchairs are clunky, painful and inconvenient. Why the hell would anyone want to be in one for longer than they had to? Not a doctor, but am a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room, and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest, and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it anytime her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the Tonopan, a device you poke them directly into the eye with, and they go, what the f is that thing? I have a sort of opposite angle story for this one. A friend of mine is completely blind, as in, eyes removed as a toddler blind. She has a rare cancer. She's worn glass eyes her whole life to keep the sockets from sinking in, as well as to limit the jarring appearance. Well, she had a new doctor she was seeing, so to speak, to get fitted for new glass eyes. I think that was why, when the tech brought her in, they told her they had to examine her eyes. And asked her to read the vision test chart. She kept trying to explain she is blind blind, and they were stuck on examining her. Whoa, your pupils aren't responding. No shit. She finally got so frustrated, she popped one glass eye out and said, here, now you can check it out all you want. She apparently always would pull that gag on folks doubting her and or teasing her. She's awesome that way. Year medical student. On my rotation and a trauma came in from a woman that had been arrested. During the drive the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay, though some of the nurses said that they caught her peeking at us when would leave the room. We ended up getting a CORD scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids, and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up too, but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. I would never have expected pretending to be blind to be such a commonly faked issue, but reading this thread has changed my mind on that issue. I didn't know it was common either. We have a guest at my workplace who is either pretending to be blind or exaggerates her vision loss a good deal. She once yelled out to me specifically across a room. I was standing near 3 other employees of similar height and build all wearing the same uniform. Everyone has a story about her. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual Lyme crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call, but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic with her I'm crippled jet-up on again. A few weeks later I got the subpoena for the deposition, and it all became clear.